like to thank you, Mr. Medford, or is it Anderson Medford? Oh, okay, all right, okay. For all right, for coming to witness before the Public Accounts Committee. We're looking at the Auditor General's report on ensuring quality health care and health of population. And one of the things that came up in the report was the absence of a new pharmacy law and as part of the regulatory regime. So could you give us an update and fill us in on why is it taking so long to get a pharmacy law in place? And just when you answer the question, just give us your name and your title just for the record. Okay.
My name is Colin Anderson Medford, and I'm the Chief Pharmacist of the Cayman Islands Health Services Authority. I'm also a member of the Cayman Islands Pharmacy Council, and the Pharmacy Council, as a backdrop, according to the document we have here, the pharmacy law, which is now in use, is quite old. It was brought into being in 1979, and because of that, it is quite outdated. There was an attempt in 1991 to make a more updated law to suit that time, and what has happened in recent times is that the council has taken upon itself now to form a pharmacy law review committee, a subcommittee, using the council as the lead for the changes, and using the 1991 law as a preamble. The current law has been sent to the ministry, and we've had quite a few changes made to it since we've done that. Some things have been added and some things have been taken away to be current with the international standards for pharmacy practice, and also to taper it to the needs of the Cayman Islands. It also delves into future pharmacy activity on the island, so it's quite involved. However, it has come back to us with some misgivings that weren't passed by the attorneys, the government attorneys, I think it is. I stand corrected on who it is that sent it back, but I do know it has been returned to us for further review, as well as some suggestions that they made that probably would be more appropriate for the writing of the law as it applies to the Cayman
Islands. We noticed that on page 25 of the Auditor General's report, item 85, page 26, item 85, that you have put in some protocols at the HSA for the management of certain criteria. Those protocols carry the legislative weight of regulations under the 79 law, or they're just in-house policies that?
Absolutely. There are in-house policies for the HSA. Some private institutions choose to use our standard as practice, as proper practice. And we have no problems with that. But we have pretty much written our own protocols based on the UK guidelines from the UK ethics annual review, as well as the Canadian law, the American law, and also Jamaica. I've brought samples of our protocols and so on, if you would like to see those as well.
Please, if you would table them to the committee.
Sure.
It would be appreciated.
If I may say this, the document was a bit limited when they said that we had only had protocols for antibiotics in pediatric use and acute pain for adults, because we do have a very, I just brought a sample and I couldn't bring more. It's just so many. And we're also in the process of daily updating these protocols. I've brought a sample of chemotherapy and anticoagulant therapy and the general outpatient dispensing process as well.
Mr. Chairman, through you, while he's looking for those, can you tell us if you're satisfied that these are the best practice international standards that we're using, just for the record?
Okay, we do have some limitations, obviously, because there's some things that we do not have the infrastructure to implement. But for the most part, the standards, I would say, and I say this based on my training in Scotland, Barbados, and to a lesser extent Canada, and based on the criteria that comes out annually, we have got a fairly high standard of practice on the island, considering that there are limitations as far as the law is concerned. We seek to fill the gaps of the law at the hospital. That's the best way I can put it. Sorry.
Yeah. But surely, I mean, for the listening audience and also government, I mean, the fact that we're missing laws and proper procedures that have been formally set out, both in 85 and 86, and I know that part isn't on yours, but the obstetrical care. I would hope that the government would take this opportunity to take this report and now move with haste to encompass this new pharmaceutical law and the best practice procedures and let's get it done. If you're saying that this is 1979, it's time to modernize and memorialize the procedures in a one-stop document.
Yeah, the new pharmacy law is very inclusive, and it will also be a very good aid for customs as well, because it deals a lot with the importation of drugs by persons who are not permitted to do so, which is not in any of the other versions of the law. And obviously, it is a problem with trafficking and so on. Sorry. These are the references and protocols. And these are just a handful of the guidelines that we have formulated ourselves, some over the years and some recent times. And that would include also our own hospital formulary, which is currently being updated.
And these will all be represented in the new modern pharmacy law.
No, well, this is just HSA.
Yeah, I know, but the requirement or it will be addressed in the law in a way that would enable this to carry weight.
The law encompasses proper practice,
right?
Using best practice solutions as well as evidence-based medicine. So because of that encompassing criteria from countries that have established laws, we've tapered it to our practice on the island for both private and public practice.
What seems to be the delay? Because I happen to know that this has been in train for at least, I'm aware of at least the last 8 to 10 years.
Yeah, the 1991 law, I don't think it ever reached the legislation.
No. It was passed into law. I got it in my hand.
I'm not sure.
Right.
You've never been able to use it.
It was suspended by there was a change in election 1992.
Okay.
Right. And it was the law was not brought into force properly for various reasons, which I suspect are the same reasons that you are encountering the impediments and the stumbling blocks that you are now in terms of getting in place adequate legislation to be able to give the public the confidence that the profession of pharmacy is being conducted in a modern professional way, and it is being and it has in it the necessary controls and the ability to write in-house protocols which will carry the weight and the support of legislation.
Absolutely. One of the things we did to circumvent the deficiencies of the law was we developed, I think, about 6 or 8 years ago, maybe 6 years ago, the council as well developed something called the standards of practice, which pretty much helped to taper the practice of pharmacy broadly, island-wide for all practitioners. And within the remits of the standards of practice, we were able to extrapolate some of the practice issues that would have been encountered by both private and public pharmacy.
But that is a voluntary code. That's not mandatory. Right?
No, it is. Well, it is adhered to by the practitioners, but it is not. It by no means can replace a law.
And it can't carry consequences. Does it have offenses for which there are consequences?
The consequences would have to come at the discretion of the council, I believe.
For licensure
or malpractice or breach of the codes.
Mr. Chairman, through you, in terms of your role in monitoring statistics on drugs, narcotics, forecasting, inventory, and importation requirements for the country, can you explain that role and again what the kind of wrapping around that is in terms of where do you get your mandate? How do you report that, or who do you report that to, and then what happens after you make those reports?
Absolutely. First of all, we follow the United Nations Convention for International Narcotic and Psychotropic Drug Handling, Shipping, Manufacture, Producing. We follow that very closely. And I must say that we do that in tandem with the National Drug Council. The National Drug Council is they pretty much do the data analysis for us. And they've been doing that now for the last, I think, about 5 years. As far as the process is concerned, if I may get into that, the convention was enacted by the International Narcotics Control Board, based in Austria, which is a sub-arm of the United Nations as well as a subsidiary of the World Health Organization. And what they sought to do was to bring the entire world into a control, a legal framework for controlling narcotics and psychotropic drugs. Along with that, each country has to set up a competent office which deals with the process from start to finish. They deal with both importation and exportation. For Cayman, we do not export narcotics, and we do not manufacture or grow, as far as I know. We don't grow any medicinal narcotics or any kind of narcotics for commercial purposes, legal commercial purposes. But what the framework has done is it has presented a very stringent control using statistics, and these statistics are weighed against what you've ordered, against what you've manufactured, against what you've produced, against what you've exported, and it's all balanced and tabulated by the International Narcotics Control Board. They also have another arm that deals with other drugs called psychotropic drugs, and these would include things like benzodiazepines and so on. But what they have done is they have made sure that government bodies have a competent authority or a competent office that is answerable for the movement of narcotics in the country. And one of the important things to note is that the statistics are also taken from the police force as well as the customs, seizures or whatever you may call it. Whatever statistics they have, they're asked to forward to the National Drug Council in order to go into the annual. The reports are done on 4 times a year. There are the quarterly reports, and then there's the annual report.
You sign off the quarter reports as government chief pharmacist now for the
I
narcotics?
signed off. I don't really sign off the reports. That is done by the chief medical officer. Okay. So I work under the chief medical officer in this capacity, and she is the person who would be pretty much the director or manager of the narcotic controls of the Cayman Islands.
I'm sure you would have been as alarmed as I was to see that they are, it looks like they are business people who expect to be able to import medicinal cannabis. And the law currently requires that narcotic control. So I think that there needs to be some kind of a press release or something to make it clear that the way the law is drafted currently, that's not got possible to happen legally.
The thing is, I think when you look at the other jurisdictions, Jamaica, Canada, most of the other countries, if not all, and some of the ones that are pretty obscure, tiny, you realize one thing: they all have an office that only deals with this. So in my capacity as chief pharmacist of the HSA, I'm a bit tenuous to say this, but there is some conflict of, the International Narcotics Board has not given any disapproval of what we're doing because I've actually outlined it to them. But at the same time, I'm purchasing just like any other pharmacy for the hospital. And at the same time, I'm regulating. And so there's nobody really monitoring me besides the chief medical officer who is literally getting the information from me. So what happens in other jurisdictions is there's an office set up. In Jamaica, it's the narcotics, I think they call it dangerous drugs, but they're moving away from that terminology now for the sake of the patients, that is. But the dangerous drugs department of the Ministry of Health, and what they do is, that is all they do. They see after the recording, the movement, the balancing. There's an inspector who goes to every pharmacy and looks at those books at random. And that would include me. If he came around, he would be looking at my books as well. Now, in 2002, I think, when the hospital became a statutory corporation, we lost that empowerment. And I think that office I don't know much about it because I was not in the fray at the time, but what I do know is that we did have that inspector in place. And I think we did have the formation of a board. I don't know how active the board was, but the pharmacy board would have been regulating those things with the inspector in tandem. The inspector also inspected for other reasons, setting up a new pharmacy, pharmacy practice, whether or not your place is locked up, when no pharmacist is there, simple things like that, but essential. We do not have that office right now, and I think that is one of the things that, and I'm sorry if I'm digressing, but that is one of the things I think is essential to good pharmacy governance and practice. We need to have somebody who oversees the chief pharmacist of the HSA and somebody who oversees all of the pharmacists on the island and keeps them in check according to expected guidelines. So we could have a law and we could have code of practice and everything else. But if we don't have somebody who enforces that, then we're still going to have problems.
Yeah, one of the things that we talked a little bit earlier this morning was moving the role of CMO up to the policy level, the minister level, where that person could have themselves or have under them the necessary staff to do that kind of thing, so that you wouldn't have operational people like yourself having to regulate yourself.
Absolutely, and that is worrisome. Yes.
Yeah.
Getting back to the INCB, I'm sorry. The INCB also enforces this. So if you don't submit your documents on time, if you don't submit your quotas on time, if your reporting documentation is deficient in any way, they will write to you several times, and each time they write to you, they will tell you that this is your fourth and your third or fifth warning, whatever, and then they will tell you that you need to get, if you have any problems, you need to get in contact with their home office where they will help you to resolve the problems. And I find they're very patient, even though they're enforcing it. But at the same time, there is an ongoing body that oversees the movement of narcotics, medicinal narcotics, worldwide.
Do they still use your annual statistics in order to grant your request? In other words, if you try to get too big an increase, they will question why.
Absolutely.
Right,
Yes, that has happened to us for oxycodone. Oxycodone has increased exponentially. The use of it has increased. In fact, if I may say, I don't have exact statistics, but our narcotic use on the island in comparison to, let's just say, 2010, maybe 2012, has increased exponential, by my opinion. And that happened to us when we went from a 300, I think, 300 grams to, I think, 800 grams because we had to. And you had to provide documentation to prove why it was so.
In your opinion, is that because doctors are using it genuinely for acute pain, or are they using it to wipe out minor pain so that there's a perception that he's a good doctor?
That's something that I would not be able to say. What I can say is that we've got a lot more physician and pharmacist confidence with the proper use of narcotics. We've also got more pain specialists. We've got pain specialists. We've got anesthetists who are also pain specialists in their own right. We've got a much higher level of patient care as far as pain is concerned. We've got the hospice. And because of these things, you're seeing things like fentanyl patches and so on moving a little bit more than they used to when I first started years ago. And the confidence that has been rooted in training for doctors and pharmacists and nurses as well nowadays has given rise to more use of the drugs. The other thing too is that we've got patients who are overseas referrals, and they go to the hospitals overseas, and the doctors, they use them widely in the United States and to a lesser extent England. I'm not too sure how England does it, but I know they use it to a much lesser extent. But Canada, US, patients will come back and they'll want refills. And obviously...
Do you have any way of determining whether there's any abuse that might lead to addiction, or are you not seeing those turning up?
You will see it in patient patterns. You will see it in the way patients behave towards getting the drugs, or the things that they will do to get the drugs and so on. But when it comes to solid investigation, we've not ever done that really. What I can say is that there's a very high level of communication between all the pharmacies. So if you see somebody who is coming every week to you for oxycodone or for something else, you'll call the other pharmacy. Well, look, even if you don't call the patient's name, you'll say, we've got a patient, and if it continues, we'll give you a call. And we've done this on several occasions, and it's very effective. We close them down. The patients, we stop them. Yes.
But in Mr. Chairman, through you, is it right to say that there is no shared pharmacy information system right now to ensure that the patients aren't receiving the multiple prescriptions from the different physicians and obtaining them? I mean, it's good that you can call, but there's no, tracking, I guess, of, pharmacies this month issued that much more oxycodone that would start triggering, the data would start triggering some action.
There is no computer system on island in place at the moment to do that. It is available in the United States. I know they do that. But as I don't want to say archaic, but as complicated as it is, I think we must give credit to the both doctors and pharmacists on the island who helped to stem the habits of some patients. And I can say that this is something that happens almost monthly. We can come across one of these cases somewhere where someone was halted in their efforts to obtain a narcotic or a psychotropic drug against the wishes of their physician. So we don't have a system which would be better, which would obviously be much better, but we don't have that at the moment.
Is the hold up on the new pharmacy law related to economic factors or related to professional provisions in the law?
Based on what I've understood, is there are some requirements that were placed in the law. Now, remember that we as lay people, as far as law is concerned, were the ones who pretty much put the laws, made the changes, and forwarded those to the higher authorities. I think in some cases our requirements were not up to par with what is expected as far as the national law is concerned, and we were asked to review as well as to consider inserting certain things that would make that law much more applicable.
I guess that I can understand the legal phraseology, but I'm a little concerned that we have the Farms Council itself drafting instructions, which is based on what you would have prepared in legislation, and your decisions on what needs to be in the law are being second guessed by laymen or even by attorneys.
Oh.
So I'm hoping that they're not trying to remove things that you want in the law, but it's just a matter of the way it should be written legally.
I'm not absolutely sure.
Okay,
I just know that there were changes requested. Honestly, I haven't seen the request, but I do know, based on our discussions in council, that we're at the drawing board again for certain things.
But yeah, I hope that it I hope that this law gets put in place fairly rapidly, because I fully understand the ramifications and the need to put it in place. And I also, I guess, unduly cognizant of the stumbling blocks that you're up against, having had to endure them myself, both as chief pharmacist at the hospital and as Minister of Health, who piloted the 91 legislation. So I'm acutely aware of what you're getting up against, and I hope that we find a way around it in short order that does not lead to any compromise in the professional ethics and standards and the ability to regulate the industry.
Just one final question for me. In that, again, is it accurate to say that someone traveling abroad would get a prescription from an overseas doctor? There's no account for these drugs being brought back in, meaning customs, no requirements for them to report that to HSA or anybody, and therefore there's a risk that you could go away and get your Oxycontin and other things from an overseas doctor, or pharmacy, and not and you then wouldn't have any indication of that patient's drug history.
It is possible. That is a problem with the lack of regulation as far as drug acquisition and importation is concerned. And I say importation meaning somebody with a legitimate prescription coming from a doctor overseas that has written it and they've bought it at CVS or somewhere. We don't have any controls. We don't have controls to say that you can't import X, Y, or Z. In Jamaica and other jurisdictions, there's some drugs, if they're not on your register, you can't bring them in. It doesn't matter who needs it. You just can't bring it in without going through the rigorous process of trying to get it registered to be in the island or in the country. And the lack of a law has caused us to fall into that trap pretty much where the purchase of drugs is open, and this is the legal purchase of drugs by suppliers now, is open to anything. You can purchase anything from anywhere. Now, as far as patients coming back from overseas is concerned, we've had situations, and I must say that we work very closely with the customs. Ever so often, and very often, they call us for help with identifying or trying to figure out whether something is a prescription drug, whether or not it was acquired, whether or not the patient has got more than would be expected to come in on a prescription. And that happens quite often. But what we have seen is that, yes, patients can go overseas and collect the drugs and so on. I don't think there's a customs law that stops that. But customs, at the same time, does do quite a bit of seizure and quite a bit of searching that turns them up. And we see them. I don't think they'll catch everybody. I doubt very much. But to say that there's nothing being done it's kind of a stretch. We don't have any legal framework for it to be dealt with. We don't have that yet. It is included in the new pharmacy law, but we don't have. Obviously, we don't have that.
That was going to be my next question. Meaning, if not, then hopefully that is a part of the recommendation and something that has been accepted and not pushed back.
Yes, importation by the correct sources is a huge section, well, a huge part of the law.
Are there currently any local suppliers of medicines that do not have a pharmacist on staff?
Not to my knowledge, no.
Yeah.
Not to my knowledge.
Okay.
No, not at all. And if it's not owned by a pharmacist, it's the drug area is run by a pharmacist.
Okay. Any other questions? Okay, sir. Thank you very much, and we wish you the best. And we will be making some recommendations that we hope will enhance your batting average.
Thank you. Thank you very much.
Thank you. Thanks for coming. The committee will now adjourn until 9 o'clock.
Can I just do one intervention in terms of this overall document? It might be too premature right now, but if it is, you can tell me otherwise. That I think it's incumbent on us as a committee to strongly recommend to the government that this set of reports and the protocols and criteria recommended be taken on and used as the baseline for reporting back on the issues raised, if not annually, at least biannually. And I'd like to recommend that we do that in the final report.
Absolutely. I think it's it's a good base to stand on, and I would like to see the report updated. From my point of view, I think it's sufficient. It would be, it should require an annual update, because it also will drive the various agencies to put in place the necessary matrices to measure it, rather than just let it sit and say, well, nobody has access to a report, and the next time we need it, the Auditor General has to go through all kind of drawers and cupboards and doors and alleys and whatnot looking for files and papers. So I agree that that should be a recommendation from the committee. So the committee is being adjourned until next week, Thursday, at 9 o'clock, and that the 9th of February, 9 a.m.
Mr. Chair, just if you could give me a second, I'd like to thank the committee for the acknowledgement at the beginning of the session, but I'd just like to also mention that it was a pleasure over the last 8 years to serve this committee, and that it was a real honor, actually, to serve this committee over the last 8 years, and especially the last few under your chairmanship, sir. So, again, bid you adieu, and thank you very much.
And Ruben, we wish you the best, and again, I will put on record our appreciation of your efforts and the standard to which you have raised, in particular, the performance reporting aspects of it. And for that, we will always be grateful, and we will do our best, as long as I'm around, to make sure it doesn't slide backward. But thank you very much, and we wish you the best in your future endeavors. We'll adjourn until 9 a.m. on the 8th of February. 9th, sorry. Thursday, the 9th of February.